People are stressed out, burnout, overwhelmed, and we're not getting enough sleep, period. And we're searching as a result, we're looking for answers. Well, the answer might be at your workplace. You might be able to, as a medical practice administrator, you might be able to reduce turnover, reduce burnout, and improve patient outcomes if you just focus on the underlying cause and focus on helping people get a better night's sleep. And the way to do this is to look at your culture, to maybe look at the way that you're incentivizing, whether it's instead of a step challenge, maybe it's a sleep challenge, creating opportunities for people to track things, creating reward programs, and then as you have a healthier, happier workplace, look at ways that you can measure on a regular basis and then put it out there in the community and let people know what you're doing. It'll help you in so many different ways. And I bet you, medical practice administrator, if you put together certain pieces of this in 2025, it will probably help you get a better night's sleep as well. Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I am also Jennifer.
And today we're going to talk about something that I feel like I talk about all the time, and that's just not getting enough sleep, how it stresses me out, and how it impacts my overall wellness.
And how you perform on your job on a day-to-day basis.
I don't always perform that great when I lack sleep, especially when I think about I have like a sleep tracker. I have so many sleep trackers, and I'm going on just under 5 hours from last night, and I'm tired today. And I know it's impacting my mood and everything else. And so what we want to talk about is, look, if it's happening to us, it's happening to you, and it's happening not just to your patients, it's happening to your employees. And that means it's impacting your bottom line and it's impacting your patient outcomes. So what should we be doing about this?
It is a huge issue because when you talk about it from a whole perspective, here you're this physician talking about health and wellness and all of these things.
But you haven't slept.
But everyone in your practice is up here, including the doctor. They're not sleeping, they're stressed out, they're trying to do too much at the same time and balancing that work-life balance. And then you have stressed out patients coming in, and it's like the perfect storm. It's really creating the perfect storm.
It is. And so there's a report that came out recently talking about consumer trends in healthcare, and it's looking at like 200,000 different search terms online and what people are searching for and what that might mean from a decision-making standpoint. So in the past year, we've had a 6% increase in online discussions around insomnia. You know, this is something that I feel like we talk about all the time.
Insomnia.
There's been a 44% increase in conversations about magnesium for sleep. Studies show that chronic sleep deprivation leads to decision-making issues, increased risk of heart disease, and mental health issues like depression and anxiety. That makes me very nervous because sometimes I feel like, I'll be lucky 3 nights a week to get a good night's sleep. I don't even know what the definition of a good night is anymore. And then on top of it, burnout and stress are significant causes of reductions in quality of care and quality of outcomes in a healthcare environment. So if you're a medical practice administrator or a doctor, and you're thinking about all of your employees and how it's not just the doctor, but it's downstream, what are you supposed to do?
Actually, take a snapshot of the culture within your practice. What is the workload? I think everybody right now is dealing with staff issues. They're short-staffed from every department in a practice, from HR to front desk to nursing to support, whatever the case may be. Everybody in every medical practice is short-staffed right now. I think really taking a good look at the support system and the culture that you have going on within your practice, and does that support or make the situation worse, Are you listening to your staff? Are you hearing? Is somebody going through something that maybe, just having that break room and that time to just step away if you need to, but really understanding what's going on in your practice and what that culture is like, and looking through it from a lens of a new patient coming in.
Well, not even a new patient.
See?
Yes, absolutely.
Yeah.
Okay.
What do they see when they walk in the door? Is everybody on edge?
Is everyone on edge and anxiety?
Exactly.
Exactly. Like when you're looking at your culture internally, making room for those conversations around mental health, acknowledging that new mommies or your menopausal employees are probably going through sleep deprivation right now. And sometimes that brain fog is directly related to the things that they're dealing with from sleep deprivation. Create an opportunity for those conversations to take place, and maybe look at those wellness programs and beyond just, we're going to give you money to go to the gym, but maybe we're going to help you get better night's sleep, or we're going to teach our employees what they can do to make their bodies more adaptable to a better night's sleep.
Exactly. We always talk about, educating your patients on a healthy lifestyle. Well, let's educate our employees as well. If you don't get a lunch and they're eating at their desk, that's not healthy. You need a break. You need a timeout. You need a reset to, start the rest of the day, especially if you're sleep deprived. And knowing that and being aware of your employees, I think, creates a different kind of culture.
Yeah. So first, you want to create that wellness culture. Take a look in the mirror. 2, you want to provide those resources for stress management, whether it's an opportunity to take a break from your desk and from the daily grind. Maybe it's relaxation rooms. I know that's like not necessarily going to fly in all parts of the country, but if you are working in California, you can get a relaxation room, no problem. If you're in Florida, you probably won't be able to get a relaxation room. We joke, but we're in Florida. Develop on-site programs like mindfulness. Teaching mindfulness, especially to the older population. Younger folks are, they're really like in tune with mindfulness. Older folks, maybe not so much. Maybe, promoting yoga, promoting things of that nature.
I was going to say that, or even I know we do have a practice up in Louisville, and they have a walking group at lunch. Anybody can go. There's usually about 5 of them, but they walk the parking lot on their lunch hour. That builds camaraderie, builds a great culture. You're getting out, you're getting exercise, you're getting some fresh air, and you're taking a break.
I think that another one is, promote and encourage healthy lifestyles. And so I think back to a handful of years ago when we were all, especially at the beginning of the year, where we were handing out what are they called? Pedometers. We were handing out pedometers, and we were saying, you got to get 10,000 steps a day. You'll be healthy. We're going to be healthy together. And we were having step challenges within the practices that we were working with. Well, now, what if we did sleep trackers? And everybody downloaded the sleep tracking app on their phone. And in the new year, your wellness initiative, instead of like steps, it's more, let's focus on sleep. Let's track the sleep as teams. Let's make sure that we're getting enough sleep, which means in order to sleep, everything else around it has to happen. And that's the healthy wellness challenge that we do for the new year. Instead of steps, let's focus on sleep. Getting the steps will help you sleep.
100%.
But creating those opportunities and those games and those fun things that we can do to promote this overall wellness around sleep.
Absolutely. I'm going back a little bit about what else you can do and opening up these conversations, and not to put something else on a already tax day to give you, practice manager, one more thing to do. But maybe creating those anonymous surveys that you could send out to your employees to just get a pulse on the status of your employees, and make it a little bit personal, or a little bit more like, we're here because we want to support you. This is anonymous. Your name does not have to be involved, but you can kind of get an idea of what's happening in your practice. And maybe it's that little quiet 24-year-old girl at the front desk who maybe has a really sick mom, or would never say a word to anybody about anything, but is literally having some major turmoil going on outside, and taking that extra step to provide them with the support that they need is going to create a lifelong employee. And it can all be done anonymously.
Something that we do for our team is we do like a weekly Net Promoter Score survey. It's 100% anonymous. I schedule it to go out, and I say, hey, reminder, take your weekly survey. And then I get it, and I can take all the feedback in the survey, because it asks everyone to rate the week, on a scale of 1 to 10, and then to provide some feedback of why you gave that rating. 100% anonymous, and we've been tracking it now for probably about 40 weeks, give or take. And we have some really good data. And so each week, every other week when we meet as a full team, I will say our net promoter score for the week was 7.6 or 6.2 or 8.5. And this is some of the themes that we got back. And people were stressed out. We'd have a lower score because there were too many interruptions during the day. And then we try to build in less interruptions during the day to keep that stress level down. You could take that same concept, do it with a Google Drive doc, which is what we're using, create a quick survey. That quick survey will help you measure those things like, did you get enough sleep this week? Did your job stress you out this week? On a scale of 1 to 10, how were your patient interactions? Because you could use that data then to make adjustments to your wellness program and to make adjustments to the programs that are driving that culture, which is what it's all about, driving a positive culture of wellness.
Absolutely. The other thing too, I think, as we talk about, really building in like a healthy lifestyle, one of the things that we used to do with the larger hospital system that I used to work for is we got involved in community events. Every community has a cancer walk or a heart walk or just a 5K on the weekend. Building a team in your office to give back to your community and maybe support some things that you have going on within the office, to really be an advocate in your office to creating that healthy lifestyle. Create a team, participate in a walk, really show your camaraderie within your office. Show that to the community. You're building a healthy lifestyle, you're building a team, you're being involved in the community. Like that checks a lot of boxes.
It really does, it really does. And I think what it boils down to is, look, there's data out there saying, and we all know it, we don't even need the data to support it. People are stressed out, burnout, overwhelmed, and we're not getting enough sleep, period. And people were searching, as a result, we're looking for answers. Well, the answer might be at your workplace. You might be able to, as a medical practice administrator, you might be able to reduce turnover, reduce burnout, and improve patient outcomes if you just focus on the underlying cause and focus on helping people get a better night's sleep. And the way to do this is to look at your culture, to maybe look at the way that you're incentivizing, whether it's instead of a step challenge, maybe it's a sleep challenge, creating opportunities for people to track things, creating reward programs. And then as you have a healthier, happier workplace, look at ways that you can measure on a regular basis and then put it out there in the community and let people know what you're doing. It'll help you in so many different ways. And I bet you, medical practice administrator, if you put together certain pieces of this in 2025, it will probably help you get a better night's sleep as well.
I agree. I mean, even just taking the initiative to educate your staff on the impact of stress and not sleeping and how that affects your work-life balance, not just at work, but outside of work, it really will go a long way.
That's it. So with that, I'm Jennifer.
And I am Jennifer.
We'll see you next time on the Dr. Marketing Tips Show. Thanks a bunch.
Bye.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.